Now, this week, the South African government has asked the International Court of Justice to make an order of provisional measures against Israel to prevent full-scale famine in Gaza. Pretoria asked the court to order the immediate cessation of all hostilities, the release of all hostages, plus the provision of humanitarian aid to prevent starvation. Well, for some reaction, Dr. Mustafa Barghouti from the Palestine Liberation Organization joins us now. Dr. Mustafa, appreciate your time. Thanks for your patience. Now, as a representative of the PLO, could you provide some insights into the current humanitarian situation in Gaza, particularly regarding access to food, water, and other essential supplies?
Well, I must say that what we see in Gaza today is the worst kind of war crime. You are talking about Israel conducting 3 war crimes at the same time: the war crime of genocide, the war crime of collective punishment, and the war crime of ethnic cleansing. The humanitarian situation is the worst ever. It's the biggest humanitarian crisis caused by human beings. We are talking about, first of all, a total destruction of more than 70% of all homes in Gaza. The destruction of the infrastructure, water pipes, electricity, sewage systems. Every part of the infrastructure is destroyed, and that affects, of course, daily life. In the north, in particular, there is a complete and total siege and lack of access to food, to milk, to clean water, of course. Because of that, we have 700,000 people in the city of Gaza and the north of Gaza starving at the moment. And they started dying. Up till now, more than 30 have died because of starvation. And this number will increase dramatically because 350,000 of those who are starving are children. In the case of the rest of Gaza, what you see here is a total disaster from health perspective, because 155 days have passed without any vaccination to children, which leads to the outbreak of infections. And in addition to that, the lack of water, lack of food, and lack of medications and lack of medical treatment has led to a widespread amount of diseases. Our estimates, we have 30 medical teams that work with our society, Palestinian Medical Relief there, and they report that we have about 1 million people sick today in Gaza, including people who are suffering from respiratory infections, from diarrhea and gastrointestinal infections. We have more than 10,000 people who are already infected with because of the outbreak of infectious hepatitis, and there is a huge number of skin diseases. It's a total disaster. In addition to that, we are talking about 50,000 pregnant women who cannot find a safe place to give birth in. Some had to give birth in the streets. Some lost their babies because of lack of sanitary conditions. We have 64,000 breastfeeding women who need to feed their babies, but they cannot do that properly because they themselves don't have food, don't have vitamins, don't have milk. It's a very serious problem. And in addition to that, we are talking about very stressful situation because people don't have homes. Many live in the streets. When it rains, they are in very bad shape because the tents they live in or lack of tents makes them vulnerable to cold and many other complications. Many people reported that in the north they had to eat plants which they don't know about, and some of them got intoxication because of these certain plants.
Dr. Mustafa, if you'll allow me to come in and focus a little bit on how the PLO assesses the effectiveness of international efforts, including those led by South Africa and other nations in addressing the ongoing crisis in Gaza. The South African authorities have yet again gone to the ICJ in a plea, obviously, to curtail the wanton killing of innocent civilians in the Gaza Strip.
We appreciate so much the position of South Africa. We appreciate very much what your president and most important, your foreign minister have done. by dragging Israel to the International Court of Justice. South Africa did what many other countries did not dare to do, but they did what they did because they respect justice and they respect international law and they respect the application of international law. And who can blame anybody for taking the case to the highest court in the world, the ICJ, the International Court of Justice? We appreciate that very much. For us, South Africa has become the hero of the Palestinian people because you stand with us, you support our just cause in every possible way. But the case in the ICJ is very important because the ICJ itself have admitted the plausibility of the case of genocide, and Israel did not respond to the instructions of the court. So now it is very good that South Africa is going back again. What we need is immediate ceasefire to stop this atrocity. So far, more than 37,000 people have been killed, including no less than 13,500 children, no less than 9,000 women, and 73,000 others have been injured, and many of them will die because of lack of medications. I am a medical doctor by myself, and I never thought in my life that my colleagues will call me and tell me that they had to amputate a leg of a man without anesthesia because they didn't have anesthetics. This is the kind of atrocity we have. We have more than 1,000 children already who have amputation of their legs or hands. And what broke my heart more than anything else was listening to that child, 5 years old, who lost both of his hands, asking his father, "Will my hands grow again when I grow up, my father?" This is the kind
Dr.
of
Mustafa,
atrocity that we face.
I have to come in there and just talk about you are pushing for a ceasefire. The world is pushing for a ceasefire, and hopefully that happens in the next few days. But I want to touch a little bit on the future of the Palestinian people and the future of these individuals in Gaza. The young boy that you talk about, those whose limbs are being amputated, and what does the future hold for them in terms of a peaceful resolution to this conflict?
First of all, not all countries of the world are calling for ceasefire. The biggest obstacle to having an immediate ceasefire is the United States of America, which is blocking each time the passage of a resolution of a ceasefire in the Security Council, regardless of the fact that 156 countries of the world have voted for ceasefire. What we need now is to stop the killing. What we need now is to stop the suffering. What we need now is to stop the starvation of the people. And then we have to rebuild our country. And we have to rebuild our structures. We have to bring back life to Gaza. And we are determined. We are very resilient. This is not the first war that is conducted against Gaza. It's the 5th war, but we've never seen such a level of devastation. But I believe we have to rebuild Gaza completely, bring back homes. People are insisting to stay, and we want them to stay. We will not allow Israel to conduct ethnic cleansing. But I also say the world must pressure Israel to pay compensation for the damage they have caused. This terrible damage that they have been bragging about and showing videos about. We need to rebuild our hospitals. 30 hospitals out of 36 were destroyed. We need to rebuild our clinics, which were destroyed. We need to rebuild our universities, which were all destroyed. We need to rebuild our schools. I don't think any country in the world, in any war before, has seen this level of devastation, including in the Second World War. Somebody made a comparison between Germany after the Second World War and Palestine. And they said that in Germany, only 10% of homes were destroyed. In Gaza, more than 75% of all homes are destroyed in less than 5 months.